Here now, three people on the front lines of the epidemic. Keir MacDonald is the Deputy Executive Director for Lookout Society. It's an organization that provides housing and outreach services for the homeless. Wendy Muckle is Executive Director of Ottawa Inner City Health. And Judy Darcy is BC's Minister of Mental Health and Addictions. Thank you all for joining us tonight. Minister, I'm going to start with you. More overdoses this weekend. You're in the middle of a crisis. What can you do now to save those who are already addicted?
Well, this is devastating news from Abbotsford, and we have been seeing 4 people a day dying in British Columbia on average. Those are all people who have loved ones, families and friends who are devastated by these losses. We can't allow it to become the new normal. That's why our government, it's one of the reasons our government created a Ministry for Mental Health and Addictions, the first one in Canada, and it's why in our first budget we are escalating the response so that we have more harm reduction out there, more safe consumption sites, more access to naloxone in order to save lives, access to other prescription medications. I just approved a new guideline in that regard just a couple of weeks ago. But it's also very important that we have treatment options available for people, because when we save someone's life in the overdose crisis, if they go back to living on the streets, which is often the case now, we're not giving them a pathway to hope. So we're also moving as quickly as we can to ensure that there are more opportunities for treatment, that we're taking action on homelessness, because the majority of people who are homeless are also people living with mental health and addiction. So we're really taking an all-of-government approach, because we need to deal with the social factors that are one of the important contributing factors to this perfect storm that has been created now.
It is a perfect storm, as you've described, and you're right in the middle of the crisis. What aren't you doing?
Well, we are pouring it on. We are doing everything we possibly can. We've just invested $322 million over the next 3 years. We're escalating our response. We are ensuring that we're going to have a coordinated structure for the entire province, so that we are hearing where all the hotspots are, so that we can direct resources and supports exactly where they're needed. But also, just recently, as I mentioned, we are expanding access to prescription drugs like prescription hydromorphone, which is another tool in our arsenal to ensure that people are not using poisoned, toxic drugs, which is what's killing people right now.
I want to bring in our other guests here. Keir MacDonald, you've heard the minister. I know your focus is and worry is housing, in part, for people who are addicted. What do you see on the front lines that's needed, and what's working?
Yeah, look, housing has been a big factor in the increase and spike in homelessness out here in BC, some 30% increase before the last count. You know, at Lookout Housing and Health Society, we actually also operate 2 of the new supervised consumption sites in this province. So we had one open in June and another in July. So we've really been seeing everything from our outreach through to our shelters and housing, through to now the use of those 2 new facilities.
Okay, Keir, just for our audience, supervised consumption site, what are you talking about?
Yeah, so many people may know Insight, who's been around for something like 14 years now. Supervised consumption is a new iteration of that. It's effectively an expanded use, expanded forms of use. So rather than just being able to come in and inject a drug, you're able to come into SafePoint and the Power Street Getaway now and also orally and nasally use those drugs.
Wendy Muckle,
under the supervision.
One of the things I've wondered about is, for some Canadians, many perhaps, this crisis seems to have come out of nowhere, all of a sudden exploding. Is there a gap between how much we know about the crisis and whether we consider it a national health emergency?
I think it's interesting that you comment on that, because I was actually in Vancouver back in February and saw what was going on. And when I came back to Ottawa to try to raise the alarm, really nobody was all that interested. And it really has taken a long time for people to really appreciate the enormity of the problem we have here and the complexity of the problem we have here. And I think that, you know, as a country, we need to learn from our colleagues and prepare ourselves for things which frankly are inevitable. So I'm very appreciative of all the help and support we've gotten from our colleagues in Vancouver, but also a bit frustrated that we're a bit slow to the party.
So you're in your jurisdiction in Ottawa, you're doing some innovative things. What are you doing, and do you think it's worth expanding?
So one of the things that we're doing, which the minister announced, we are offering prescribed hydromorphone to people, and we're hoping to very quickly expand that program. I do think that it is something that probably needs to be expanded right across the province, but you know, we need more things and we need more innovation, and we need that platform to be able to learn from each other and to have new and different ideas. This is a health crisis which is unprecedented. We've never seen the complexity that we're dealing with in any other disease process that I can remember. You know, people call this the AIDS crisis, and AIDS was much simpler than this is, much easier to manage. We need innovation.
Keir MacDonald, do you think that we understand the addict, and do you think that we're tackling well enough preventing people from becoming dependent?
I think we're fighting what we can see right now, and so there's been harm reduction responses across the board with enhanced supply of naloxone and supervised consumption sites and overdose prevention sites, but sometimes I worry that we don't fully yet understand this issue and exactly who these people are that are dying alone in their homes, which is the overwhelming majority of the population that are dying from these fatal overdoses. So, I mean, I'd love to know a little bit more about the histories, and we've talked about a potential coroner's inquest over here to fully understand the stories and what is leading people to use alone, and the stigma that continues to exist and social isolation that, despite all of these resources that are now flowing, it's just not having a dent in reducing the numbers.
Minister, if I understand correctly, you are in favour of legalizing some opioids. And with people already worried about legalizing marijuana in this country, why do you think that's an answer?
Well, I think we need to learn from other jurisdictions. I mean, the issue of criminalization, legalization is a federal matter. We're doing everything we can within the current federal framework. But I think the fundamental issue is that we need to start treating people who are living with addictions with the same dignity and respect and quality of care as people who are dealing with any other kind of physical illness.
What's your worry there? That we aren't?
Well, there is still a huge stigma that is attached to it. That's a large reason why people use alone. I think that, and people are dying when they use alone. I think it's critically important that we also understand how it is that, you know, what it is that leads to addiction. And we know, all of the clinical experts will say that trauma is a huge factor. Sometimes that's physical trauma, people living with a lot of pain and becoming addicted to opioids initially. For many people, it's also psychological and emotional and social trauma. So in British Columbia's case, Indigenous people are dying at a rate 3 times higher than the population at large.
Yeah, that's astounding. Well, all the statistics around this crisis, frankly, are astounding. And I am wondering, Wendy, if this idea of stigmatizing addicts is, how much of a barrier is it to tackling this?
This is the thing, really, which prevents our success. When the opioid crisis first hit Ottawa at the end of February, and we started regular meetings with the drug-using community, what was really clear right off the bat was that this us and them attitude, this inability for us to understand their world and their perspective and to respect it, was killing people, and that we needed to really approach the community in a different way, and really to build on the strengths of that community. That is really the only way out of this. We don't understand the illicit drug market. We don't understand why things work the way that we do. The only way we can come up with good solutions is by listening to the people who are experts.
Keir MacDonald, what are you seeing in terms of people suffering from this? It's not just, you know, chronic drug addicts. It seems people are becoming dependent quickly and fatally in a large cross-section of the population.
Yeah, as the Minister referred to, I mean, the more we're understanding this issue and the people that are suffering from this, it's revealing underlying trauma and pain. Many people have suffered as a child or a youth, or whether that was injury, illness. People are getting onto, prescription drugs, prescription medications, and so now that we're tackling the use of opioids in prescriptions, as those were weaned off, people was continuing to self-medicate and unfortunately dealing with much more harmful drugs like fentanyl these days. So many of the stories we're hearing is it started with, these weren't people that were hardcore drug users. These were people that started with medication to address trauma or pain.
Minister Darcy, we just have a minute left. You know as well as I do, the U.S. declared this a national health emergency this week, elevating it in the public consciousness and in strategy. Is there something that we need to do? Would that help in this country?
Well, we have certainly called on the federal government repeatedly, and I was at my first federal, provincial, territorial meeting of ministers of health just last week in Edmonton, and we're certainly calling on the federal government to remove any of the barriers that are in place to us getting life-saving treatment into people's hands. And they are collaborating with us, but we think that we need to go further than that. We need to be able to put in place harm reduction sites more quickly, access to methadone, access to drug checking services, and we also think it's critically important that we build a national anti-stigma campaign, federal government and provincial governments cooperating together in order to get the message out to Canadians that this is a health issue we need to stop treating. We need to stop stigmatizing people. You know, when you break your leg, you know what kind of treatment and care you're going to get when you go to an emergency room, and you know what the follow-up is going to be. But if you go to an emergency room, or if you live through an overdose crisis and you survive, you don't get sympathy, you get stigma. So it's critical that we start seeing this as a health issue and really give people living with addictions the kind of support and care and dignity that they deserve.
All right. Thank you, all three of you. I know we're going to continue this conversation. It's desperate. Thanks very much.